Assembly Bill 1795 will ensure that patients with behavioral or alcohol intoxication need have more direct access to appropriate care, while also ensuring hospital emergency room departments continue to be utilized to provide life-saving care to patients who seriously needs it through illness or injury. Many of us personally have experienced waiting in emergency rooms for hours and hours. In 2016, emergency room departments statewide visits over 14.5 million times, an unsustainable trend that puts lives of patients at risk. Hospital waiting times continue to increase. Currently, when paramedics respond to a medical emergency, the assessments of patients is quickly done. Appropriate first response care is given, while necessary transportation is being considered to transport to an emergency room for further treatment. The emergency room is the default destination. However, there are cases when the emergency room is not the appropriate setting for patients. Let me repeat that. There are cases when the emergency room is not the appropriate setting for patients.
When I assumed command of the organization in 2011, we responded on 240,000 emergency medical calls. Last year, we went on approximately 400,000 calls. I looked at our data from last year, and we just looked at our top 25 utilizers of the 911 system. The top 25 utilizers of the system called 911 last year an average of 33 times. The top person, 70 times. 70% of those calls were abuse calls. 69% of those calls were for mental health emergencies. 100% had either or. And 94% of those were transported to an emergency room, not the right facility to transport to.
For example, people who have too much to drink and the underlying medical issue does not reach a level where the emergency personnel need to be addressing it. This is caused by tying up these particular kinds of services. In the same vein, for an example, when a patient's having a panic attack or needing medical and mental health services, care, are quickly addressed through a behavior individual by transporting an individual to the appropriate location instead of tying up emergency room personnel. This bill requires that during a medical transportation by a paramedic and constant connection with a medical personnel at the hospital safely is transported. We already trust our paramedics to stabilize our loved ones when they are experiencing a heart attack or a stroke or other serious illnesses. In a split decision, paramedics need to make the right decision. This bill will simply allow specially trained paramedics to help those patients without waste, without any interruptions.